All right, folks, so fatty liver disease is a condition that causes over 2 million deaths worldwide, I'm told. And Dr. Mike Mills is a consultant physician and gastroenterologist, and he joins us now to explain more about the fatty liver disease. Morning, friend. Good to see you.
Morning, thanks.
All the very best to you and the family for 2024. What is the role of the liver first before we get to the fatty liver stuff?
Okay, liver is an essential organ. You only have one liver. Most organs can be paired, but the liver, it only sits on the right side as a single organ. It's the largest solid organ. It's responsible for basically producing a lot of proteins, a lot of processing of anything that goes into the blood, detoxifies the body, for example. It helps to process bile, so it's important in digestion. All the bile is made in the liver and stored in the gallbladder. So it's a very essential organ.
Yeah, essential. I mean, we can't do without it.
We can't do without it.
Yeah. How come I just want everybody else, everything else
yes,
is too, but we can't do without it? Mm-hmm. All right. So how does this disease come about now?
Okay, so the first thing is that fatty liver disease is the term that we used to use. So we've actually stopped using it because the term fatty can be associated with a stigma. And so in the medical field, people recognize that if you tell people they have fatty liver disease, it's like saying someone is fat. It's not something that we like to do. So we've changed the term to metabolic associated steatotic liver disease.
All right, only you alone can say that.
Okay, so the thing about it is the essential part of that is steatosis. So fat.
Steatosis.
Yes, steatosis is the medical term for fat. And whenever fat occurs anywhere in the body, it can be normal or abnormal because there are fat cells which are supposed to be there. A certain amount of fat which helps to cushion the tissues and provide an environment for things to work normally. But when it ends up in places where it's not supposed to be and in large amounts, then it can cause a problem. So for example, in the liver will store fat cells just like it stores some other nutrients. Mm-hmm. And then when it starts to accumulate inside the liver cells, there can be inflammation associated with that fat. And then that can cause destruction of the liver cells or hepatitis or inflammation. Mm-hmm. So inflammation associated with fat is what we use to term fatty liver disease, and it's now called steatotic liver disease.
Mm-hmm. Specific foods cause that?
Well, it's associated with a number of things. Food can be one of them. It's associated with metabolic syndrome. So that's individuals who have diabetes, for example, hypertension, high lipids or cholesterol, obesity. All these things are associated with excess fat, which can accumulate in the liver and cause inflammation. And of course, the foods that can cause these things will also predispose you to fatty liver.
If that happens to me, can I tell that something is not right or no?
It's very difficult to tell sometimes. If it's associated with symptoms, by that time it's usually very severe. So the liver is very enlarged and very stretched. You can get discomfort in the area where the liver is on the right side. Jaundice is very rare, but it's not impossible to get. Most times it's picked up either by doing an ultrasound, for example. So someone is doing an ultrasound for another reason, and then all of a sudden the radiologist notices that the liver appears to have a lot of excess fat in it. Or if you're doing an executive profile, for example, if those who do it annually, you see your liver function test or the blood test reflect that there's inflammation in the liver, and fat can be one cause of that. So it tends to be something that you need to pay attention to as a healthcare provider, for example, to know that patients are at risk for having excess fat in the liver, which can be problematic. Because a lot of the times, doctors in particular in the past were not quite sensitized to the severity of or the effect of fat in the liver, and it was being passed off as just being fat in the liver without any side effects long term.
Is there any pain?
There can be discomfort, but that's very unusual. So we wouldn't wait for pain.
I wouldn't know if there's anything wrong.
You wouldn't know. So knowing that you're at risk for having fat in the liver would then clue you in to go and do some kind of a test to decide if the liver does have fat. Yeah. So individuals who are diabetic, for example, the prevalence of fatty liver or steatotic liver disease in diabetes to 50%. So if you have type 2 diabetes, every other diabetic potentially would have excess fat in the liver. Yeah. And you need to know this because you need to know what the risk is and to see what the long-term effects are.
Can you just use your hand and show me where the liver is?
The liver is located here on the right side, just at the lower part of the rib cage. Mm-hmm.
And how big is that organ?
Well, it's about, if you're going to outline it, it's going to start in the midline, come across to the end of the rib cage, go down. So it's located right in this area.
Fairly big.
It is fairly big, that's right.
Yeah. How prevalent is fatty liver disease, or the new name?
Right, steatotic liver disease. Yeah. So we do know that worldwide about 20% of individuals may be at risk for fatty liver disease. As I said, it can be higher in type 2 diabetics, for example, so up to 50%, and some ethnicities even higher than that. So it's rapidly becoming the number one cause of chronic liver disease worldwide because of the increase in prevalence of obesity and the associated effects of diabetes and so on.
You've already answered the question, truth be told, but I'll ask it again because I just want to understand for sure that there's no possible way I can tell that there's something is going on.
It's not likely. Let me put it that way. Waiting for symptoms is not the thing to do. As I said, if you do have symptoms, there may be discomfort in the area of the liver if the liver becomes stretched. And just like most liver diseases, you may have jaundice if it's very severe, but jaundice is very unusual with fatty liver disease. So we do want to sensitize, especially healthcare providers, to look for the condition as doing a type of screening, for example, to see if there is excess fat in the liver. And you can do this by doing an ultrasound, for example. So individuals who are at risk, so if someone is overweight or obese, you want to look for actively fatty liver by sending them for an ultrasound. Or if they're diabetic, definitely all diabetics need to have some kind of screening to see if there's excess fat in the liver.
Can it be fatal?
It can be. It's very unusual because the liver goes through a number of stages before it becomes cirrhotic or scarred. And cirrhosis or scarring is associated with adverse outcomes. It's a similar process to alcohol. So the same thing that alcohol causes to the liver, which you do know about cirrhosis, it's fat in the liver from alcohol. But when you have steatotic liver disease or fatty liver disease, there's no alcohol involved. So we used to call it non-alcoholic fatty liver disease, but we know that it's associated with other things and can progress. So we want to find individuals who are at risk for progression because those are the ones who we want to prevent them from developing cirrhosis and liver cancer.
How is it treated?
Well, the key thing is to manage the underlying risk. So obesity, so exercise, weight loss, reducing things that will increase the amount of fat in the liver are key. You want to control the diabetes, you want to control the lipid profile, you want to take steps to make sure that you're reducing your metabolic risk profile. There are some medications, but the medication use is very limited at this time. And so you definitely want to look at lifestyle and managing those chronic conditions to try and improve the situation in the liver.
Try and improve the situation.
Yes, because you want to make sure what stage you're finding it. If you have the stage of scarring or fibrosis, that may not be reversible. So you only want to slow things down.
But they are
in the early stages, when it's just fat in the liver, you can completely reverse that.
It can be reversible. Do we have, you said it can be fatal, but as far as you know, have we had any or many deaths because of this?
It would be very, very difficult to say. We used to have a condition or category of chronic liver disease called cryptogenic, where we're not quite sure what's causing the cirrhosis. But that's because at that time we didn't recognize in the past that fatty liver or steatotic liver disease was a severe condition. So it could have been that some individuals who we were not quite sure what the cause is was as a result of that condition earlier. But certainly now that we're more sensitized to this condition, we do recognize that there are some cases, but as I said, there are very few. Most cases of chronic liver disease or cirrhosis will be from more common things like alcohol or viral hepatitis, hepatitis B, hepatitis C, for example, other liver conditions. So those are the things that we tend to look at in terms of fatality. But definitely you can have problems from the liver, from scarring, just from having excess fat in the liver.
And you already said that you can find this out by doing other things. You can, other tests.
So there are other tests that you can do. An ultrasound is one. There are blood tests you can do as well. There's a specific liver scan that we do to assess the amount of fat. An ultrasound may tell you that there's some fat, but to determine if there's a degree of fat which is harmful, you want to do further testing. The ideal thing is to do a biopsy of the liver, to take a sample, but of course that's invasive, so we do not to do that. There's a non-invasive way of doing it by doing blood tests. And then there's also a non-invasive scan that can be done called a fibroscan or a liver scan, which is recently introduced to the island, where you can assess the liver to see what the degree of inflammation is, to see how much scarring potential it is, and then use that information to guide individuals to see how to reduce their risk as best as possible.
If I can't tell that there's anything wrong, should I just ask for an ultrasound to ensure is there nothing wrong? Does it have anything to do with the like age? The older you get, is it more likely or no?
Not directly. So the risk factors definitely, as we said, obesity. So if you're overweight, if you have type 2 diabetes, if you have high cholesterol, if your family history suggests a very strong history of diabetes, or there's a history suggesting that you have chronic liver disease, then definitely you want to go to your practitioner and say, can you check my liver just to see if I have fatty liver, definitely. And then they will take steps to identify what the severity is and make the appropriate interventions. If you don't have any symptoms at all, then that's the way to go. If you're having symptoms already or your blood test suggested there's a liver issue, then definitely fat is something to be considered. Or if you did an ultrasound, for example, for fibroids or gallstones or something,
might very well show up.
and it shows up, don't ignore it. It says fatty liver in the impression. It's something that needs to be evaluated further.
Yeah. Always good to see you.
Appreciate
Thanks for
that.
coming in. God bless you and the family.
Amen. Same to you.
Consultant physician and gastroenterologist, Dr. Mike Mills. 10 minutes to your health. We'll do it again next Thursday.